Hello, everyone. Good evening. It's really a pleasure to give this webinar tonight. One of my favorite topics. So, as Liz was telling you, my background is in academia, but before I started as a professor and now as an administrator, I worked as a clinician in the Boston area. In fact, I've spent about 20 years in the Boston area. And my area is actually exercise science and preventive healthcare, and had worked in most of the Boston hospitals, running clinics to help reduce the risk for cardiovascular disease and diabetes and those types of things. And ultimately worked in pediatrics and working with children to help them to adopt healthy lifestyles. So health sciences, that's what you're going to see tonight. And we're going to go pretty quick. We want to give you an overview, but then leave time if you have questions. But what you're going to see tonight is that is one piece of a very large puzzle that encompasses what health sciences is. And that's our goal tonight, is to kind of give you an overview of the many different choices in health sciences. And I will tell you first off, and first in addition to thanking you for joining us, congratulate you, because you have picked a field of health sciences, if that's what you're going to major in, that is really booming. And we want to show you some of the opportunities there tonight. So with that said, we'll go ahead, Liz. We'll move to the first slide. And I think what might be helpful for you, again, given that health sciences is a very broad field of study, is start out with a couple of definitions. So I would say we kind of made this one up. There's a lot of definitions. None of them kind of match. But to me, it is science, right? Just like the word the health science is. It's a science field, but it also is very applied. And we focus on the practice of that science to promote, maintain, and sometimes to restore, if someone isn't at optimal health, to restore them back to health. So it's promotion is really widespread. Maintaining is, if you can get to optimal health, how do you keep it, particularly as we age? And then, like I said, restoring is kind of rehabilitative medicine. So that's our working definition. As I mentioned, it's a wide variety of disciplines in the field. And I want to just use two pictures for you. On the left, you see the healthcare careers, and it's a wonderful picture, but everyone is in scrubs. It looks like they're probably working in a hospital somewhere. And many of you, I'm sure that's your goal. And I loved my time working in the hospital system. But you know what? Again, it is one slice of the pie or one piece of the puzzle. And so if you move to the right, it's the beginning of a kind of infographic that shows you there's lots of different fields in the health sciences, and our job is to help you navigate that. So next slide, please, Liz. So I'm going to kind of walk you through what those things might be, but I want to ask you a question first, and obviously you can answer it to yourself. And that is, you might be asking yourself right now, am I sure is health sciences the right major for me as I enter college? And the way that I usually work with students on that is I ask a question back. And I would say this: are you interested in pursuing some type of career in the health field? Now, given your presence watching this, I would say that 99.9% of you, the answer is yes. I'm interested in something in the health field. Okay, great. Number two, if yes, do you know specifically what career in the health field you want to pursue? And that has, I think, two possibilities. So let's click the first one. And if you said, yep, I know I want to be, fill in the blank, and this is really what I've wanted to be for a long time, then I think health sciences can, for almost anything what you filled in the blank related to healthcare, is probably one of the top options for majors. Makes sense. It's a health study, just like we defined it. But I like the next part too. If you said no, so let's click that one, Liz. If you said, yes, I'm interested in some type of career, but on number two, you said, no, not exactly. There's some things I'm thinking about, but I don't know exactly what I'm going to settle in on, then I would say even better, because you're going to get exposed to so many things in the health sciences. If you're open, you want to do something in healthcare, and you're open to what that might be, or you've got a couple of choices, it is such a great major because you get to feel it and touch it and experience it, and then to kind of make a choice. I think I have one more click on this slide. So I can't count over the years how many students have said to me, I'm really interested in studying health or healthcare, but I don't really know what specifically. And I think, again, I always like to start with the take-home message up front. And the take-home message is if you answer number one as yes, and you answer number two as either yes or no, you're in the right place. And our job is to help you navigate kind of the many choices that are going to be open to you. All right.
That
So what are those
really helps
choices?
me too, Kyle,
Oh,
because there are so many times that I'm at a college fair and a student just says, I like my science classes, but I
yeah.
don't know what comes next. I think that's a perfect and helpful way for me to help counsel students moving forward.
Yeah, right on, Liz. I mean, I want our audience tonight to feel comfortable, confident, and good that you don't need to know exactly what you want to do, because if you think you do, I got to tell you, most likely you're going to probably change. But if you have a general direction, you're just really excited about healthcare and the health sciences, good for you. We'll help you kind of navigate and throw different options out there. Honestly, Liz, to your point, it's like we talked about, you and I talked today. It's like if you're going to business school
Yeah,
and you say, okay, what can you do with a business degree? Well, geez, you can do a lot of different things. Do you know exactly what you want to do with that business degree? Some do, some don't, some are open to it. And I would say health sciences is very similar.
absolutely.
Yeah. So let's at least throw out some examples for you, though, so you can see what some of those choices might be. And if you do a Google search on what is health sciences, you get tons of answers. And honestly, I wouldn't really recommend it because it can become more confusing, honestly. But I picked one of these up today, and I kind of like the infographic. They put them in kind of clusters or areas. They settled on five. And I said, well, that's interesting because we kind of unofficially use four or five different clusters, if you will, or pathways. And so I don't use the same terminology, but again, it doesn't really matter. So here's the bottom line. At Providence College in the health sciences, our students are kind of find their way into one of these five categories. One, allied health professions. I'm going to explain what that is. Two, public health and promotion. Three, medical research. A lot of alumni doing really interesting patient-related research. So that's a good one. Healthcare administration. We talk about that. It's, I think, more the business side of health. And then finally, the emerging area, and I know a lot of you guys are good with technology, is biomedical technology and informatics. So each of those five has a ton of things underneath them. So there's many types of careers and things you can study under any one of those. Again, you don't need to choose. You don't have to say, okay, I'm going to major in health sciences. Which of these five choices? That will happen with time as you experience the major. So, Liz, what I'm going to do, we'll go to the next slide, is I'm going to walk the audience through each of those five by giving examples. So here, folks, you'll love this. If you're taking notes, you're not going to have to write much. It picture's worth 1,000 words. So let's take that first category, allied health professions. And here, in this particular example, I kind of call this our big four. because I don't have the data exactly, but just talking to students, I would say a very high percent want or are pursuing and chose health sciences for one of these four, but many did not. Many have different aspirations. So physical therapist or physical rehabilitation, very similar. Occupational therapy, more related to restoring health in daily functions. Um, Physician assistance program, top riser, huge field, not more in therapy. There's lots of subspecialties in PA, as we call it. And then speech and language pathology, also in the team of therapeutic rehabilitation. A lot of that having to do with kids, but also working, with someone after a stroke, those types of things. And the acquisition of language in very, very young children. So that's one example of the allied health professions. It's not what I would call medical professions, but they're in medicine. Medical, I think of more physician, dentist, veterinarian, those types of things. Morgan's going to talk about that separately. Most of our students are in the allied health professions. These are four examples. Let's keep going. Here's a couple more for allied health professions. But I did a little tricky thing here is I wanted to look at a specific area of the allied health professions. And I chose, being at Providence College and all, we've got fantastic nationally ranked athletics. I chose sports medicine or human performance. And so some of though in that cluster, you could look at careers in the study in our program or others, in athletic training, exercise science. That's actually what I did. There's a picture there of a stress test. I ran stress tests at Boston Medical Center and Brigham and Women's Hospital in Boston. Up on the upper right corner, strength and conditioning coach. That's actually from one of our athletic teams. And then down on the bottom, sports nutrition. And again, I've got this cluster in the kind of sports world. Registered dietitian related to sports or not, another example of allied health professional. Next slide. Going to give two other quick examples also in the pathway of an allied health profession. Registered nurse, as many of you know, we now have a nursing program, incredibly popular, high demand program. But honestly, even if you choose health sciences as a major, we still have a pathway, a way of getting you to an end result of becoming a nurse or a registered nurse, an RN, or even a nurse practitioner, an advanced practice nurse. And the way we do that, it's called direct entry, meaning you're directly entering nursing from a different field, in this case from health sciences, and accelerated nursing, which means you don't have to do 4 years over again. If you've taken everything in the health sciences curriculum, you can become a nurse in about 15 months. Right now, we don't have, it's called an ABSN, Accelerated Bachelor of Science in Nursing. It's in our business plan. We haven't rolled it out yet. We probably will. But there's many programs, ABSN programs, that we send our students to across the nation. And then I just want to point out that we look at health through the holistic lens. And so we know the importance of a whole mental health as part of a total health and well-being. So some of our students are very interested in the mental health part of healthcare. So something else to think about.
Yeah. Even my college roommate ended up doing one of the accelerated nursing programs at a different institution after her degree at Providence. So absolutely that preparation is going to be there. And students, Active Minds is one of our larger student clubs on campus working with mental health. So that's going to fit in perfectly with this
Yeah.
type of field.
Yeah, and this is why exactly, Liz, and this is why I'm so excited about the field. There's so many great, exciting choices. So here's some more. Now, this cluster, a pathway I'm going to call public health and promotion. So classic public health careers include being an epidemiologist. You're tracking populations, and having just come out of COVID, I think we all learned so much about epidemiology every night on the news. So it's data, Its prevalence of disease and influence and of medications on that prevalence. There's lots of things to that. So if you're really interested in data, epi, as we call it, is a great field. Environmental science, the way that our environment affects our health and our healthcare is incredible. And it doesn't affect everyone equally. There are disparities in environmental impacts on health. And so we can study that as well. So you might be very interested in being an environmental scientist still in the health field. Health educator, working with, for instance, a diabetes health educator. You're going to work with people who have diabetes. You're going to teach them what to do, what not to do, how can they help change their behaviors, and so forth. And then global health. Again, our focus in our program at Providence College is to have also a lens on how health is being affected around the world and how we can be a positive influence in global health. Next slide. So medical research, we have some fantastic students doing great work that go on to careers at here at Women and Infants Hospital or the Miriam Hospital or Rhode Island Hospital. I have students in Mass General and on and on. So you can take a look at the pictures, but clinical trials, maybe there's a new drug. I chose a picture on clinical trials in the HERS study. And her study is around breast cancer prevalence. And so a student with a background in health sciences understands the human body, understands disease pathology, is a great asset to clinical trials and having a role as a research associate at a big hospital academic medical center. And then there's others that you can see here. Next slide. So kind of the last few here, I wanted to, they're very different than what I just showed you. Healthcare administration, which is tightly tied to our Department of Health Sciences in the Health Policy and Management program, to me is where health and business meet. And so up in the left-hand corner, we have many students pursue being a healthcare administrator, might be a hospital, might be a community health organization, might be something else. Even into the business of medical sales, medical equipment, those types of things. And then, of course, healthcare and business analyst analyzing data from those settings. And then on the bottom, I was amazed this year. I talked to 4 different students. We were doing a little kind of poster presentation that all are going into healthcare law. One of them had been accepted to 4 different law schools. So this, again, very different from what I presented so far. And I'll finish up with just a couple and we'll go from there. Again, I think technology, as you guys all know, biomedical technology, informatics, and here's some examples on this screen. I think artificial intelligence is changing healthcare in a very positive way for the most part, and it's allowing us to speed even faster advances in healthcare by bringing in the artificial intelligence and other types of technologies. I love the picture up on the top. Obviously, a man with an amputee, but think about how computer science and application of prosthetics has changed over the last 10 years and will continue to change through robotics and other things like that. So all under the umbrella of health sciences. All right. Now I'm going to finish up and pass the baton over, but I just wanted to show you something. And this is the U.S. World News and Report's top jobs of every profession in the United States. And if you look at even the top 10 in 2022, it was what, 6, 7 of the top 10 were in healthcare. Now they switch back and forth, new things come up. In 2024, this one just came out. You can see that some of the fields that we were just talking about dominate the list. So you couldn't have chosen a better field of study than healthcare. And whatever you choose within it, I don't know of any healthcare job that's not growing and flourishing. So you're really in a really great spot. Next slide. Okay, and just one quick note on our curriculum, because you can look this up. But what's the reason it's so easy to jump between maybe different interest is that something called a prerequisite. A prerequisite is a course that's needed in a particular health field. And those courses are shared in many of the different professions that I just showed you. So maybe you started thinking, I want to be an occupational therapist, but you took this really great nutrition class with one of our faculty members. Is like, I love nutrition. You know what? I think I want to do that. Those courses have a core that is almost identical, or at least very, very similar. You don't lose ground by changing your mind. Anatomy and physiology will be there regardless if you're moving. Chemistry, and we teach chemistry within our own department in collaboration with our Chem department, and on and on. So I think it's a really important point for tonight is that this whole idea of I don't really know exactly what I want to do, but it's okay because the types of courses I'm going to need follow the different areas in healthcare. And and that's what we're really proud of. And then the other thing is we have a lot of electives. So if you want to study abroad, it's no problem because we're able to do that in a way that you don't get behind, that you can use some of your electives and take those abroad while taking some of your major courses here, and those types of things. Also, health science is great for a double major or even a minor, and really free reign. We have everything from dance as a minor to business as a double major. So, and the reason we're able to do that is you've got a lot of electives built into the curriculum. So I think that's my part.